Hello, my name is Lauren Bucci. I am a student nurse, and I am addressing the disparities in healthcare in relation to mental health in children. The significance of mental health is frequently underestimated when assessing an individual's overall well-being. However, given the rising suicide rates among youth, it is essential not to disregard it any further. Youth suicide is a serious public health problem, responsible for more deaths among youths aged 10 to 24 years than any single major medical illness, according to the American Academy of Pediatrics. Nemours Hospital recently published their community health assessment for youth in Delaware, and the report found that the main community issues were access to mental health care, mental health/trauma, and access to medical health providers. This data leads to analyzing the disparities and barriers among school-aged children in urban Delaware. It requires a comprehensive understanding of various factors, including socioeconomic status, access to health care, and health insurance coverage, all of which are problems noted by the Nemours Community Health Assessment. When talking about socioeconomic status, families with lower incomes may struggle to access essential resources, impacting children's health and well-being. Additionally, limited access to quality education can affect health literacy and awareness among children and their families. There is also inadequate access to health care among different children in Delaware. Some urban areas may have healthcare deserts, limiting the availability of healthcare facilities and services. Limited transportation options can also hinder families from reaching healthcare providers. If families do happen to find a provider for their children, some of these patients may lack appropriate health insurance coverage, which would limit their ability to access timely and affordable healthcare services. Even with insurance, high out-of-pocket costs may discourage some families from seeking necessary healthcare or treatments for their children. This community health assessment, performed by Nemours, should open eyes all across not only the state of Delaware, but also throughout the nation. Access to mental health care should be easily accessible to everyone seeking this care. As a nurse, I would like to advocate strongly for equal access to mental health services for all children, irrespective of socioeconomic background, ethnicity, or other demographic factors. Nurses also understand that early intervention in mental health is crucial for a child's overall development. Also, as a nurse, I want to emphasize the importance of collaboration between healthcare providers, educators, and community organizers to create a comprehensive support system for children. I recognize that addressing mental health disparities requires a holistic approach that goes beyond clinical settings, so politics needs to strongly be involved in this process. Nurses like me may start by engaging in advocacy for policies that address the root causes of mental health disparities, such as poverty and inadequate access to resources. We understand that systemic changes are necessary to create lasting improvements in children's mental health outcomes. House Bill 200, introduced on April 23, 2023, in the Delaware General Assembly by Representative Longhurst, is an act that establishes a mental health services unit for Delaware high schools. In order to offer prevention and support programs and services to students, Delaware schools require mental health professionals with training and experience. This bill will decrease student-to-counselor ratios and expand high school students' access to mental health services. Additionally, this act establishes a reimbursement program to incentivize current school personnel to obtain professional licensure or certification in mental health areas of critical need. As a nurse, I can fully endorse this bill, as it will decrease the disparities talked about earlier, because it expands access throughout schools in Delaware. Thank you.